Hello, everyone. Welcome to today's 12 o'clock webinar. Today we are learning about nurturing mental wellness in older adults, specifically looking at accessing resources and supports. My name is Yana Vigor. I work at CAMH's Patient and Family Learning Space, and I will be introducing the presenting team today. It is presented by PSSP, which stands for the Provincial Systems Support Program at CAMH. And this team is presenting today's Understanding Mental Health and Wellbeing in Later Life initiative, which offers evidence-based solutions to meet this need. Today, you will discover their accessible resources, which focus on empowering older adults and their families to access support networks in their community. These resources will include community-based workshops for older adults hosted across the province, online courses for service providers, multilingual information sheets, webinars with subject matter experts, and more. I'd also like to take a moment to acknowledge that CAMH, as a physical structure, is situated on lands that have been occupied by First Nations for millennia, lands that are rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas, also known as Turtle Island. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. So it has been a deeply important site of meeting, learning, and decision-making for a very long time. And today, Takaranto is covered by the Toronto Purchase, Treaty Number 13 of 1805 with the Mississaugas of the Credit. I'd like to take this moment to remind us all that we are treaty people, and so knowing our treaties, learning about them is deeply important. Takaranto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. And CAMH, as an organization, as a group of people, asks us to make a commitment to reconciliation. And so we do our best to honor the land through programs and places that reflect and respect its heritage. We aim to embrace the healing traditions of the ancestors and weave them into our caring practices. I like to add that we try to do this in ways that are respectful and non-appropriative. And we aim to create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. And I like to offer this as an invitation to connect with us if you'd like to be part of creating those new relationships and partnerships. If this is your first time learning about the Patient and Family Learning Space, we are an interactive hub for patients, families, friends, loved ones, kin, and the community to access reliable information about mental health, substance use, and recovery. We have a physical space at 1025 Queen Street West, which is the downtown site of CAMH in Toronto, where we offer our services in person and virtually in sessions like these, and we have resources for you to take that are print, web, and app format. You can attend interactive workshops and webinars and discover a variety of community-based services that might help you in your recovery. So please do come visit us anytime you're on site. We know that some of the information and stories that are shared on webinars and web events like these can remind you of your own experiences and affect your well-being. It's very normal for conversations around mental health to affect you even after the event has ended. And so we really encourage you to lean on the relationships and practices in your life that make you feel supported. We are not clinicians at the Patient Family Learning Space, but we do have access to resources and can help connect you to services if you need extra support. My colleague Alexa is putting some resources in the chat, which we will also send out in a follow-up email, and you can ask for the support you need in the chat, and we can follow up with you if it feels useful. I'm delighted to introduce our presenters today. Michelle Chin is a bilingual knowledge broker at the team PSSP. Lindsay Turner is an interim manager of knowledge mobilization, strategy, and special projects. Angela Yip is a manager of community-based knowledge mobilization. And Chris Colombe is a mental health educator in the health promotion department. With that, I will pass it over to our presenters.
So welcome to today's webinar. I'm Michelle. I'm joined here with my presenters, and we're here on behalf, as Yana said, as part of the Provincial System Support Program here at CAMH. So I'll pass it over to Angela to kind of give us a bit more of an overview of what PSSP is.
Thanks, Michelle. Hi, everyone. We're delighted to be invited to present, to share our resources with you all today. So just a little bit about us. We are part of the Provincial Systems Support Program within CAMH. Our knowledge mobilization team is part of PSSP and really works on the ground, collaborating with partners all across Ontario. Nationally as well, and some international partners to really help build a more evidence-informed system and really getting evidence, research evidence, lived experience evidence, cultural evidence, really fusing that all together and helping stakeholders become aware of this knowledge and then also help to put it on the ground. So with that, PSSP does have also has health equity, lived experience engagement, implementation, and evaluation expertise. And I'll just include a little link in the chat box for everyone to find out a little bit more about the knowledge mobilization team at CAMH, including a new video that we have posted on the site for all of you to learn a little bit more about the community-based knowledge mobilization that we do. So one of the initiatives that is funded through the Mental Health and Addictions Center of Excellence, where we're funded from, is Evidence Exchange Network, a mental health and addictions knowledge exchange network. So this knowledge exchange network is really built by 4 stakeholders, really to connect people and also people with evidence. So this site here hosts a lot of our different initiatives, including our older adults work that we're presenting here today, and all of our resources there. So we encourage you all to please check it out and find some different communities of interest, communities of practice, as well as different projects and resources that we support. And just a little bit more about our community. In brief, we also have an online collaborative platform, ENET Connect, where currently over 18,000 members connect and really share resources, ask each other questions, answer questions, comment, share news, share resources, share webinars. Our calendar of events is one of the most popular. Ton of different free resources there. You can also join. It's free to join. You can also join and post resources yourself, share what you have developed, and also webinars, and even ask questions and connect with others in the system. So I will also paste a link to that. So we do encourage everyone to check out these sites and share your knowledge and resources as well.
Thanks, Angela. So for the agenda for today's webinar, the main bulk of it is really sharing to you about the Understanding Mental Health and Wellbeing in Later Life initiative, the resources that we offer for older adults, for caregivers, and for loved ones who are supporting this population. Following that, we'll kind of touch on some upcoming goals that we have for the next year, and then we'll conclude the webinar with a Q&A session. So yeah, just a little bit more about the initiative itself. So we were originally funded through the Ministry for Seniors and Accessibility, but now our funding is provided by Ontario's Mental Health and Addiction Center of Excellence. A lot of our resources, and the main one will be this workshop series I'm touching upon, has been developed in support of not only our staff members, but an advisory committee members, as well as subject matter experts. So I guess just to start off, our global population is aging, and in Ontario, more than 18% of the population in 2022 was aged over 65 years and older. So really, attention to healthy aging is more important more than ever. And we know that older adults can experience a range of mental health challenges. It can be from minor setbacks to disabling impairments. Therefore, high quality care can help prevent some of these challenges and improve the outcomes. However, there are knowledge gaps, limited specialized care options, as well as systemic barriers that can prevent older adults from accessing these supports when they need it. So that's kind of where this initiative kind of came in. Our goal really is to help mobilize the best possible evidence on aging and mental health in formats that are also most useful to those who need it, to really help advance the mental health and the vitality of older adults. Our initiative has three aims. The first one is raising the awareness among older adults about mental health, addiction and substance use, and where to access help. Also responding to the unique needs and strengths of our older adult population in Ontario, ranging from immigrant, refugee, ethnocultural, and racialized groups, and among Indigenous older adults as well. And then finally, our third aim is to address the needs of older adults who are living in long-term care and retirement homes. So really, in order to meet all of these goals and mobilize evidence, this is kind of where we've kind of set the ground to start off this evidence-based workshops. We have online courses and resources for service providers, caregivers, and older adults. So I'm happy to share in kind of the next few slides with everyone. And just to note that a lot of our resources are, we work very closely with our community partners when developing to make sure that they are relevant and as well as applicable to the older adults that they are serving. So this is just a snapshot of this map here on the left. Is you'll find is our workshop facilitator kind of network. So we have over to this date, we have 96 workshop facilitators located across the province. We've reached over 2,000 workshop participants and have delivered, our workshop facilitators have delivered over 150 workshops. So kind of in the next few slides, I'll talk about different resources that we offer with this program and where you can access these. So at the bottom, there's a QR code. Feel free to scan it. You can kind of explore the website and see the types of resources that are available and kind of the ones I'm talking a bit more today. So our big one is our community-based workshops. So our workshop series. And we know that a large and active part of the community, Ontario can only thrive when its older population thrives. Yet it's estimated that 17 to 30% of older adults in the province have mental health problems. And research has really shown that there is a gap in mental health promotion and awareness programming for older adults, and that this gap could really lead to a major burden on the healthcare system if it's not addressed. So to address the gap, we created this evidence-based structured mental health curriculum. It's really aimed to increase older adults' awareness on mental health, mental illness, and addiction issues. So here are it's a 12-part series workshop, and I know there's actually a few of our workshop facilitators here today. All of these workshops are available in both English and French, kind of covering a range of topics from mental health, mental illness, and addictions related topics. Our top three most popular workshops are the depression one, anxiety disorder, and as well as number 11, positive mental health in later life. The average duration of these workshops range from an hour and an hour and a half. And so if you are an older adult attending here today and are interested in participating in a workshop in your local area, feel free to reach out at olderadults@camh.ca. We'd be happy to kind of connect you with one of our workshop facilitators. On the other hand, as well, if you are a service provider who would maybe be interested in delivering these workshops in your communities, feel free to email us as well, and we can get you in touch. On our website as well, you can find pre-recorded versions of some of our workshops. So we have a recorded version of the overview, anxiety disorder, opioids and other medications, positive mental health, and understanding your care options. And so next, I'd like to pass it over to one of our workshop facilitators, Chris. Chris is a bilingual older adults workshop facilitator who has been with the project since 2023, to share a bit about his experience delivering these workshops and the impact that it's had on the older adults. So I'll pass it over to you, Chris.
Thank you, Michelle. It's great to be here. I appreciate the invitation to come and just share my experience as a facilitator with understanding mental health in later life. Once again, I'm still fairly new when I think of the invitation less than a year ago to really take a look at the curriculum, to see how this can benefit individuals in our community and for the Sudbury Manitoulin area. I work with the Canadian Mental Health Association. This really fits well with my mandate and my role and responsibility as an educator. What I've experienced so far in the 8 workshops that I facilitated is, and once again, I recall the last group that called and said, I heard from a friend that you went to their home and that you shared this information and we want you to come. And this came from an older adult, which was great. And it just shows that, there is a need, there is interest in sharing resources and sharing opportunities to talk about, difficult things. Again, difficult conversations and life, as we know, is not always easy. And to have a safe space to come together to share an opportunity to focus on one topic. And as a facilitator, what this Center for Addiction on Mental Health has done here is really created the curriculum that allows me as a facilitator to have the not only the curriculum, but to have the resources and the handouts and the videos that are specifically focused on that topic. Michelle highlighted the popular ones, and to be honest, I have only facilitated 4 of all of these workshops so far. I'm getting ready to do a 5th one, which I'm looking forward to in 2 weeks, which is opioids and medication. And again, it's great to be able to have everything at my fingertips. Yes, I do have a background in mental health. I facilitate a lot of certification trainings around, mental first aid and suicide intervention trainings and a lot of varied other workshops. But to have something that's geared to older adults has been like a real blessing. And once again, most individuals, need to have this conversation about stigma. And I think the way it's structured in regards to having that conversation in the first workshop, in the overview, it gives us an opportunity to say, you know what, it's okay. It's okay to not be okay. And it's okay if we haven't been able to access these resources. What can we do today to kind of help maintain, our mental well-being? And mental well-being, when we define it in the early course, is really an opportunity for us to open the door. And Pierrette, who was a participant in, I think, 3 of the 4 sessions I facilitated in one of the older adult residences here, was going to join us today. She couldn't make it, but I asked her, I said, what would you share if you were able to join this call today? And the thing that she talked about was just, once again, being grateful for the supports that are available in our community. And there are supports there. This individual was able to access and to connect with someone that she could talk to today. And again, she was concerned about her family members, and she, as a caregiver, was not able to support maybe in the way that she would like to. And just having that opportunity to connect with those supports and those peers, and really, feel like you belong in many ways, and that you can make a difference, and you can stay well, and you can stay connected, allowed her to really, feel like this is something we need to continue to talk about. So she's coming to the next session, she said, and I think that's very heartfelt and great as a facilitator to know that we can make a difference by opening and providing these opportunities for conversations and for sharing and lived experience. I mean, it's almost like 90 minutes is never enough. I find that the social afterwards, where we have a coffee and the conversation continues, is really what this these workshop series have allowed us to do. So I encourage those who maybe have just decided to start facilitating these sessions, or those who want to promote it, to really not be afraid. The material is there. The research behind it is excellent. And again, it's a matter of providing more access to these opportunities. So in a nutshell, that's kind of what I wanted to share. I'm happy to answer questions at the end if there are any questions specifically focused on maybe some of the workshops I facilitated. But overall, I'm really happy that CAMH and that partnering agencies can use and implement and facilitate these opportunities for our communities. I'll pass it back over to you, Michelle.
Thanks so much, Chris. Appreciate it. Thank you so much for sharing your experiences. And I hope that has provided also some helpful insight just into what it's like joining as one of our workshop facilitators with the project. Yeah, so I just wanted to, Chris actually touched a bit about these multilingual information sheets. So kind of the rest, a few bits I just wanted to share also, aside from the workshop series, different resources and supports that we offer. So alongside the 12 workshop series, we also provide multilingual information sheets. They're available in 12 different languages. They typically are used as like a complement after a workshop you can provide, but they can also be used as a standalone resource. It is a 2-pager. The first page is really summarizes like key learnings from the workshop. And then on the flip side, we kind of listed some key resources of where you can access help in Ontario. So the languages includes English, French, simplified and traditional Chinese, Punjabi, Italian, Spanish, Portuguese, Tamil, Urdu, Vietnamese, and Arabic. If you scan the QR code, these are all available for free to download on our website. And then I just wanted to talk a bit more also outside of the workshop, different knowledge mobilization resources that we offer. So our resources really range from topics to help support their mental health, mental well-being, and those that also may struggle with substance use. So many of our resources that you can see on the left-hand side kind of range. Some of them are in formats of what we call research snapshots. So these are brief, clear language summaries of research articles. We present it in a user-friendly format, takes evidence-based research that's been done, and then basically outlining what you need to know, and then what you can help also hopefully take from it moving forward and move it towards action. So some of those research snapshots included impact of the COVID-19 on seniors' mental health. We also create infographics or information fact sheets. So kind of here is a list. If you'd like the full extensive list and access to those resources, feel free to visit the website to see. A lot of the resources are directed specifically towards older adults, but we also have some, as you can see at the very bottom, one on burnout and compassion fatigue for those who work with older adults and how to cope and manage with that as well. And then on the left, we also host learning engagement sessions, typically known as webinars for us. These are held in collaboration with subject matter experts and organizations, and sometimes we even have people with lived experience. And it really is an opportunity to bring everyone from different stakeholders together at the table to mobilize the knowledge, hear different perspectives on this topic to help move the evidence into action. So all of our webinars on our websites are typically recorded as well. So if any of these topics here that you see resonate or are of interest of you, you are happy to also see the recording on our website as well. And I just wanted to highlight actually one resource that was recently published on our website. This one is a plain language fact sheet on supporting older adults who experience delusions and hallucinations. So it's a 2-pager, a plain language fact sheet. We first start off by defining what psychosis means, the prevalence of psychosis among older adults, some warning signs to look out for, the impact this also has on caregivers or loved ones that are looking taking care of older adults, and then ways to help, and then where you can seek additional help. So just an example of some of the resources that is available on our website. So feel free to scan the QR code if you're interested in taking a read on it. Finally, the last thing I'd like to talk about, we also have 2 free self-directed online courses. So both of these online courses are hosted on Moodle, and actually over the past year, we had over 500 people enrolled in both, enrolled to complete both of these courses. For those that are interested in becoming workshop facilitators with our workshop series, these courses are actually part of your training. We want to ensure that facilitators can deliver inclusive and relevant workshops for diverse older adult populations. So the first course, I'll just give a bit of a background: the Aging and Mental Health, a primer on health equity, diversity, and anti-racism. This course, really, it's free, self-directed online course, really designed to increase your awareness of the social and structural factors that influence mental health of older adults, ranging from those from an immigrant, refugee, ethnocultural, and those from racialized groups. We discuss racial inequities that are experienced by older adults and social determinants of mental health, talking about the role of culture, in mental health, the impact of racism in different levels, as well as the diversity and resilience of these populations, and then as well as just outlining what is anti-racism, what is anti-oppression, inclusion, and culture humility, and we offer some strategies for you when you're working with these diverse populations. This one is only available in English. However, the second course, Supporting the Mental Health of Older Adults in Care, is available in both English and French. This course is specifically designed for service providers and staff who work with older adults in long-term care homes or retirement homes. Provides a good overview of mental health and mental illnesses for older adults in care, and includes factors specific to older and diverse populations. On average, both courses take about 3 hours to complete. So it is available for those who are interested in, for those who would like to join the workshop series as a workshop facilitator. This is part of your training, but for professional or personal learning, these courses are also available for you to register on our website. And finally, I just wanted to kind of give an overview of the impact of these resources that it's had on our last fiscal year. So in regards to our workshops, we reached over 600 older adults who participated in these workshops, delivering 43 workshops. Our multilingual information resources received over 1,600 downloads on our websites. We hosted 3 webinars: loneliness and gambling incentives, sleep and mental health, and naturally occurring retirement communities, which accumulated over 350 attendees across the 3 webinars. And then, as I just mentioned previously, our online courses, we had about 500 of those enrolled to complete both of these courses. So again, if at any time, if you are interested in learning a bit more about the resources, feel free to scan the QR code, or if you're interested in delivering or participating in a workshop near you, feel free to contact us, and we'll put our email in at the very end. I'll pass it over to Lindsay to talk a bit more about our goals for the next year.
We are going to shift gears a little bit now after we've provided the overview. So I think before I forget, because I think we're moving to questions after this, I just want to thank the other members of our older adults team, LeClaire and Chandran. They're both here today, though not sitting on the panel. Vince and Levita have been behind all of our communications, our community engagement, facilitator recruitment, monitoring and reporting, you name it. So thank you very, very much, Dan Vince. Also want to thank the broader team of knowledge brokers, researchers, evaluators, designers who helped develop things like the webinars, the research snapshots, and other resources on the website, which I hope you'll all go and check out after this meeting if you haven't already. So essentially my job is just to provide a quick summary and sneak peek of what's coming up for us. For those of you who don't know,
our kind of annual project cycle runs from April to March each year. So we've just sort of finished wrapping up our reporting metrics from last year and doing some planning for this year. We've got a couple of priority areas for early spring, summer, while we work to solidify our longer term deliverables throughout winter and spring of next year. So first and foremost, as good stewards of the public dollar and supporters of continuous quality improvement, we do have an evaluation and reporting strategy. And we really want to work on further standardizing our monitoring, our data collection, analysis, and reporting activities. The initiative's been around for a few years now, so do have a pretty good sense of the current state, how things are going, gaps that we might want to fill, and where we can use our efforts this year in order to make an impact. We know that older adults are definitely not a homogeneous group by any means, so we really do want to continue to ensure our resources are culturally sensitive, that they respond to the diverse needs and intersectional experiences of older adults in Ontario as much as possible. I think just looking at the age bracket of 65 plus alone, that includes both early retirees and centenarians. So we acknowledge that their needs and experiences might be quite different and require a variety of resources and supports to help them. We plan to work with workshop facilitators like Chris to refine our workshop participant feedback survey, to continue to track our participant satisfaction and learning outcomes, to see, that they have in fact taken good information away and received kind of information on care and support that's available to them out there in their community. Also to identify demands for certain topics that we might not currently be covering, as well as other languages than English and French. And if I'm not mistaken, I think some of our facilitators are starting to deliver workshops in Tamil, Chinese, maybe one or two other languages, which is very exciting. So we're really excited to hear what kind of responses they're getting out there in their communities. We also would like to be able to help older adults and caregivers find workshops that are happening in their area in kind of a more centralized way, so that the onus isn't solely on the facilitators to go out and recruit and get the word out. So a bit of a centralized matching exercise if we can. We need to continue to engage with our subject matter experts to ensure the existing resources that we have and curriculum are up to date and reflect the latest evidence. But we also want to explore new and emerging issues where we might be able to help build awareness and help people navigate the care system. You'll see from kind of the resources and supports that we highlighted today, there are a lot of electronic and printable documents, which are mostly words on a page. And while we make a lot of strong effort as knowledge brokers and experts in knowledge mobilization to make sure things are plain language and brief, we are currently working on some new, more creative, animated graphic videos that are based on real life scenarios, not real people, but real life scenarios that are grounded in what we're hearing from the community and from subject matter experts. And those should be a bit more interactive and engaging for the public. So really excited about those. Keep an eye out. A little bit of a spoiler alert, and I hopefully I don't get in trouble with the production team given that spoiler, but really coming along, and we little sneak peeks, and very, very excited about those. Really importantly, we're building and strengthening relationships with other organizations to see how we might be able to collaborate and lend our expertise in meaningful ways. The pandemic really limited our ability to get out there and with people face to face, spread the word. So we hope to be more physically present out in spaces, at conferences, on panels, and other public events. We're also looking into some new budding partnerships. We're considering ways that we might be able to partner with schools, like post-secondary educational institutions that offer certificate and diploma programming in related areas like gerontology, in order to help equip students with foundational knowledge about older adult mental health before they actually enter the workforce. So specifically, we've been having some early discussions with Sheridan College around that, and hope to continue these conversations throughout the summer. We've also been meeting with existing geriatric service providers in Ontario through the Provincial Geriatrics Leadership Ontario organization, sort of an interprofessional network of specialized geriatric service providers across the province. We just want to better understand their system needs and possibly help strengthen professional competencies that specifically relate to adult mental health for folks who are already out there delivering care. And actually, PGLO and Behavioral Supports Ontario recently held a summit on the topic of how to design the health and social care system we all want to age in, which is a really, really cool event and initiative. Lots participated. And there is a final report available on the PGLO website for those who are interested. We relate that today and after this session. So I just wanted to thank our partners at PGLO and BSO, in case they happen to be on this call, for undertaking that important work. I also wanted to quickly mention that an important goal of CAMH's new strategic plan, Connected CAMH, is this idea of getting upstream. The strat plan, for anyone who is interested, is available front and center, I believe, on the CAMH website. So feel free to take a look at all of the related goals under the strategy. But in terms of getting upstream, we know early detection and identification is important for a number of mental health and substance issues, but sometimes these things get overlooked or underdiagnosed within the older adult population. So this is really why we're thinking about things like skills and knowledge for future workforces. So folks can really recognize signs and direct people to appropriate support early on. And also just a bit of a personal reflection on the idea of getting upstream. I'm 40, both of my parents are over 80, and I think I would say that there are a lot of things I wish I knew when I was younger. So important for all of us at any age, really, to think about healthy aging and wellness and what that means for all of us and for our loved ones. I can share that my mother was diagnosed with bipolar disorder when I was quite young. And there was a lot of misinformation and stigma around that growing up. And I can tell you that when she finally got the support and care she needed, her quality of life drastically improved, and I think mine too. So very supportive of resources that this team has developed and made available to the public, and kind of wish some of that was available when I was younger. So really one of the principles we try to live by in our small but mighty project team is just that promoting wellness is important at virtually every stage of life, not just in the golden years. And it's at the heart of the work that we're doing. And we just hope that it's making a positive impact out there in families and households and communities across the province.
Thanks so much, Lindsay. So we're happy to take any questions or comments, reflections. Feel free to put it in the chat box, and I think our helpers from PFLS can help let us know. I don't see any questions. I can't see it on my end, but please just let us know if there's any that came up.
Absolutely. While our participants are considering their questions, I'll read out two that have come in through the chat during your presentation. So the first I'll ask is, are these resources Ontario-centric, or could they be used in other provinces?
Yeah, I can take this one. And yeah, I think our presenters, we've kind of agreed. If anyone feels that they want to jump in, feel free to do so. So the specifically the multilingual resources, especially I would say the second page where we have resources of like where you can seek help, that's specific to Ontario. But I would say that the first page is a bit more of a summary of the workshop. I think is centered around a bit more of like through a Canadian lens, so I wouldn't say Ontario-centric.
Thank you. Another question. This person is wondering if the team includes professional expertise in pharmaceuticals, sleep disorders, and occupational therapy.
I can answer that if you like, everyone. our team specifically, so our expertise is mainly in knowledge mobilization. However, I would say in the development of the course curriculum, the workshop curriculum, definitely engage with a broad range of professionals across the mental health and substance use space. So that would include OTs, pharmacists, etc. I think we may actually have a webinar with panelists who are experts in sleep, but perhaps I've made that up, so don't quote me on it.
Okay, I won't, but we'll follow up, and if we have it, I'll add it in the resource email follow-up. There's a question. Have you considered developing any workshops or tools that are designed for specific equity-seeking communities? Examples, ethno-specific communities, Two-Spirit, LGBTQ+ communities.
Yes, absolutely. It's a big area of focus working with partners on that. Some brought to bear in the existing resources and workshop curriculum. I know there have been discussions around with Métis partners around developing more culturally responsive workshop slides in that regard. There's probably some other examples, Michelle, come to mind.
Yeah, closely, I mean, I can touch a bit more on the workshop content. And so we've received feedback even from workshop facilitators on offering, like Lindsay had mentioned, like we had a Métis facilitator who worked directly with Indigenous populations, and she was interested in incorporating some more traditional teaching. So we kind of worked together with her workshop slides to make sure that the material was a bit more relevant and applicable to that population. And I know as a team as well, we're continuing, and we hear from our workshop facilitators on topics that are of interest and of emerging need within this population. So it's a good opportunity for us to hear from the workshop facilitators what topics and types of resources are of interest, and then we kind of work as a team to help create those.
Yeah, and just to jump in, when we first put all of these resources together, these workshops, our advisory table did consist of a number of community partners, the Punjabi Community Health Center, Hong Fook, just to name a couple of them. So yes, definitely voices were included in the development of this, but there's always so much more to go. So please also include your feedback, suggestions in the chat box as well, on where you want us, where you think that we need to take this and continue to push.
Thank you. I see there is one more, and then I see a hand that's been raised. So I'll ask the question and then hand it over to the person with the raised hand. A participant asks, how can we better older people's perceptions of those with intellectual disabilities? I found from experience that there seems to be a negative view on those with mental health challenges from the older generation. There seems to be an assumption that they are less than.
That's okay. I think we can see the rest of the question in the chat. So less than or incapable, would like to hear your thoughts on this concept. I'm super curious, Chris, if this has come up in some of the workshops that you've delivered directly from older adults. It's such an important point, and we hear this a lot and try to address it in our resources.
It's a great question, and to be honest, I know a few groups in my community where I facilitate mental health workshops with some content, similar content, for example, with specific agencies, who are community living, for example, is one that I visit on a regular basis in my area. And again, it's about having these conversations about supports. So there probably is an opportunity here to really develop something that could be geared. But I believe that in the stories and the scenarios or case studies that are incorporated in future curriculums, we could probably add some of those in there to really help in that process. But overall, the language is very clear, simple. I think it can definitely meet the need when it comes to intellectual disabilities. I would be very comfortable to facilitate the content that we currently have in that setting. I haven't done so, but again, there are some elements there that I see that could be modified to bring those specific stories or scenarios that could assist in bringing this education forward.
Thank you. I think Jana's having a bit of technical difficulty, so I'll jump in here. And I see Bopo has their hand up, so I'm going to send you a request to unmute if you want to ask your question.
Hi, thank you so much. This is Popo from Vancouver Coastal Health. So thanks so much. I'm the registered social worker, and I'm still familiar with CAMH, all the resources and stuff. So just now I clicked the Cantonese, the traditional Chinese one. I found that the depression and the bipolar one, the first page is excellent because we have so many seniors who doesn't know how to read English. But then for the page 2, the resources, when it links to CAMH, it shows a sorry, I'm fine. I'm not sure is there some technical issues or something, but I just want to show my appreciation to you guys because even Vancouver is, you know, multicultural. But when, for example, I encounter patients like senior who have bipolar or depression, who doesn't know familiar, I found that when I print out all the resource kits, Bounce Back or Anxiety Canada, all are in English. So I really want to thank you for all the effort to create a multicultural language, you know, to boss, and then at least they can have some concept because it's a long journey for them to explore or to kick off the mental health journey, you know, like, thank you.
Thank
Oh,
you
I
so much
appreciate.
for sharing that, Bopo. And to our wonderful friends on the West Coast, please spread the word. And like we said, that not all unique to Ontario. So really happy that you shared that. Thanks.
Yeah, thanks so much, Bopo. And Bopo was actually one of our, I mean, I think we met maybe a month or two back, but Bopo was actually one of our, I recently onboarded as one of our workshop facilitators. So definitely I can follow up with you on the flip side of, you were saying, the multilingual sheets. But yeah, I mean, it's so great to hear that, you know, also these resources are expanding outside as well of Ontario.
Great. And there's a follow-up question in the chat about how about collaborations to create Two-Spirit LGBTQ specific workshops or content targeting the community due to the pervasive levels of isolation and exclusion experienced by that community?
Yes, absolutely. Thank you for that follow-up question. Another spoiler alert, this is actually an area of focus for those new interactive videos that I was speaking to earlier, and definitely something that we want to collaborate with our partners for this year, Lorraine. So thank you for raising that. Is there anything you wanted to add to that question, Michelle, Angela, Chris?
No, I was actually the thing that came to my mind were the videos. But yeah, I think anything to add would just be, this is something that's been discussed thoroughly with the team. And, you know, I think as we're also approaching this new fiscal year and talking about areas of focus and where we're going, that's definitely been a topic of conversation with our group.
I have a question about the facilitators and just wondering, are there, who are the facilitators? Are there, you know, credentials that need to be met? Are they attached to specific organizations?
Yeah,
Or maybe just
can,
how they, how do they, you know, if somebody on this call say are interested, how would they, you know, get trained in that?
Yeah, no, great question. Thanks for asking, Alexa. In terms of credentials, I mean, we ask that you know, typically those that come and reach out to us from community health living centers, or long-term cares, hospitals, long-term housing centers, majority of those individuals that have reached out to me, who have expressed interest in wanting to become a workshop facilitator, do have already some background. We ask that you know, they do have some background in mental health, have some experience working with older adults in some capacity, as well as some experience in group facilitation. But we don't ask those who have require specific credentials. We've also had We have a few workshop facilitators that are becoming a workshop facilitators for personal reasons. So sharing these resources and kind of delivering these workshops with their loved ones or at community churches, which was one of the a recent facilitator I recently onboarded. And yeah, so for those that are interested, Alexa, I just want to make sure I covered the second part of your question. Those that are interested can email us. I know Vincent, our communications coordinator, does an excellent job in kind of outstreaming to different outsourcing as much as possible to spread the outreach of this program. So those that are interested would email olderadults@camh.ca. Following that, they would I'll book a 30-minute kind of orientation session with interested facilitators, give them a bit more of an overview, background of the project, overview of the steps required. It'll take the commitment level that'll be required, and then kind of set them off so that they'll be good to go to deliver these workshops.
Yeah, and I would just add to that, so that's sort of like from a professional expertise, high level requirement, lightly used. But we do also underscore the importance of, people are co-facilitating some sessions in their communities based on their community needs. If they don't have particular expertise in an area, so I don't know, like substance use, opioids, they may in fact partner with a pharmacist in their area if they like. And we have standardized curriculum that we try to keep standard across the province, but there's room for tailoring and flexibility. And also there are opportunities to co-facilitate with older adults themselves with lived experience, caregivers and loved ones. So it's not rigid by any means, and we're definitely open to ideas and collaborations across the province.
That's great, thank you. I think I see one more question here that's asking, are there plans to continue to translate the info sheets, for example, African languages?
Short answer, yes. We are tracking all of those, and please send them to us.
Great, sounds great. I'll give everyone, if there's any last questions, please put them in the chat. I also included an evaluation link. If you have a couple of minutes, please, I promise there's only a few questions on there, and it would be really helpful for us. And I just want to thank our presenters for this great presentation, for providing these really helpful resources. We have them in the patient and family learning space as well, and they are really well received. So thank you so much. We will send out a follow-up email with links that that the presenters and we've mentioned or included in the chat. So look out for that. And I hope you have a wonderful rest of your day.
Thank you, Alexa and Yara, for joining us, or for having us and hosting us today, and for everyone else who joined.